Hello, I'm Chris Saslow, the Associate Director for Patient Care Services here at Gulf Coast Veterans Healthcare System. This week I'd like to talk about two very important issues that continue to move us in a direction forward as a healthcare system that can be proud of the care we deliver to our veterans. The first is our SAIL report. As I've mentioned before, SAIL stands for Strategic Analytics for Improvement in Learning, and it is a host of measures that are used to determine how efficient and how well we deliver care to our veterans. A 5-star facility is a facility that has done an enormous amount of work to achieve the best care possible. Currently, Gulf Coast struggles at a 2-star rating, but we have made progress in moving toward that 3-star designation. As other facilities continue to improve, we too need to continue our momentum in improving our outcomes as well as our care that we can deliver to the veterans. Several of the issues or several of the elements that nursing service has a direct impact on affecting include things such as our healthcare associated infections that include catheter associated urinary tract infections, central line associated bloodstream infections, as well as ventilator associated events. And while we do well in several of the measures, and also including methicillin-resistant Staph aureus infections, we have opportunities to improve, specifically in our central line associated infections. Our past quarter showed significant improvement in the other areas, but as some of the data is a rolling 12 months or rolling 3 months, we continue to move out of the areas where we have had poor performance in the past and moving forward in opportunities for the future. I tell you all of this because it is oftentimes confusing to staff to identify how we as a service can impact our SAIL report with anything that has to do with outcomes. However, nursing service has a substantial influence on many of the outcomes that are driving our SAIL rating. Other areas that also are impacted by nursing performance as well as participation include our adjusted length of stay and our utilization management. It's these areas that it's critical for our inpatient nurses to have conversations with our physician colleagues on the utilization of beds and recommendations for patients moving through the healthcare system in a timely fashion. Does someone need to continue to be an inpatient, or can we more effectively manage them in an outpatient arena? Those are the kinds of conversations that should be taking place at our interdisciplinary and our bedside rounding opportunities across all inpatient beds. And this is not just for our acute care, but our behavioral health as well as our long-term care arena. Another area that nursing service has a significant participation in is our outpatient ambulatory care sensitive conditions. Some of the areas that we happen to have an influence on include things such as our congestive heart failure education, our pneumonia education, as well as our urinary tract infections. When we are seeing patients in the outpatient arena, as well as those who are preparing for education on discharge from an inpatient arena, it is critical for nursing service to do everything they can do to ensure that the veteran understands what they need to do to ensure the best health possible and to be as proactive as possible in taking care of themselves both before they are admitted to the hospital as well as they're getting ready for discharge back to home. I will continue to talk about some of the other measures in the future, but you will see us rolling out some face-to-face education to our nursing staff so that we have more participation in our nursing service efforts as we try to move forward to that 5-star rating. The second thing I'd like to talk about is our continued turnover and our continued efforts to bring staff on board. In the upcoming new employee orientation, we anticipate seeing another 10 to 12 new nurses start at Gulf Coast. Some are going to be in the outpatient arenas as well as some in the inpatient, long-term care, and our behavioral health. We have many more staff to bring on board as we continue to ready to open our beds that have been closed for some time. But we need you, our nurses, to help mentor, to help support, and to help encourage the new staff that are coming on board, and to guide them to be the most efficient as well as the happiest employees we can. I know it's a lot of work here, and you've all done an incredible job. It is no small feat to have sustained our patient care as well as our outcomes as well as we have without your doing a great job both on the inpatient and outpatient services. I think I've talked enough about what we need to focus on right now, and I just want to say in advance that I hope you all have a wonderful Labor Day as we prepare to make sure that we recognize each and every individual who works hard Monday through Sunday, both inpatient and outpatient. Please give one another a warm pat on the back and recognize that what you do matters and what you do is as important as anyone else here in the healthcare system. Thanks very much and have a great day.